The linchpin of the service is the ketamine lozenge service that we provide. I became really curious about psychedelic assisted therapy and was very inspired, to watch documentaries and read about it and learn about it. I then had to seek out how to learn how to become a ketamine therapist. And so really that's how Silva Wellness was born. If somebody is using recreationally the ketamine, the mindset is very different. They're using it because they want to dissociate, they want to get away from they want to escape their feelings, or they want to use it addictively. And obviously in the clinic, they're doing it for a very different reason. They're coming in because they want to heal that. They want to work through those things. And of course, the setting is very different because you're in a safe container. You have a therapist and you have the nurse there, in that particular setting. My mission is to get this into the NHS so that more people can access the treatment.
Hello, welcome to Drugs Unwrapped with myself, Rob. Today, I'm delighted to be joined by Lucy da Silva, who is the CEO and co-founder of Silva Wellness based in London. Lucy, welcome. How are you?
Hi, Rob. Yeah, I'm very good. Very, very happy to be here. And thank you for having me on. Very excited to get into the conversation.
Yeah, absolutely. No, thank you for your time as well. And we were mutually introduced by the great Neil Wood as well. So yeah, so thank you to Neil as well for making the introduction. We may as well just get straight into it, Lucy. We'll obviously come on to ketamine assisted therapy shortly, which is obviously the main kind of topic of this episode. But Silva Wellness, tell us all about Silva Wellness, how long you've been going, what you guys do, how people can access it, and so forth.
Sure. Okay. Well, I think it's one of the important things I always try and draw into, when I'm talking about the business and how it came about is the personal motivation as to the reason why I'm in this whole industry, really, because I personally am in a journey of addiction recovery for 12 years now. So I was in rehab 2014 and out for alcohol and drug addiction, and also quite a severe eating disorder as well. And so my career and business idea has been born out of personal struggles with mental health. So and working in the field now for about 8 to 10 years. Over time it's kind of grown arms and legs in different ways, but my my journey into the mental health field, well, really did start with my own journey, which I think sometimes can make the best of practitioners, but then also I through being inspired from being in rehab and following that path and being introduced to the 12-step fellowship, and very, very grateful for that beautiful journey that I had and I'm still having. That I was in awe of the addiction treatment therapists that were in the treatment center, and I knew that that was a path that I wanted to follow because I'd always been called to help people, but I wasn't really sure how to go about that because a lot of my upbringing was very traumatic. I had that past. I don't really need to go into it. I'm sure there are some listeners that probably understand that immediately, and it might resonate with some people having that background and how addictions do then develop as a result of it. I was very lucky to get into treatment and start my recovery journey, but it all wasn't plain sailing, and I but when I came out of treatment, I was in corporate at the time. I was actually working in insurance. And previous to that, I used to travel quite a lot with my singing because I'm also a professional singer. And I now weave that into my work as well with the healing work that I do. But I'd left school with not really any GCSEs, not as a result of my academia or my actual abilities. It was because of what I was going through at home at the time. So, coming into recovery and sort of seeing these therapists and the work that they do and being inspired by it, I had no idea how I was going to get started with it. And, having very basic level of qualifications, if none really at all, and having not gone to college, yeah, it was quite a journey. So I had to really sort of, a lot of stuff came about through, well, I mean, I'll call it luck, but I think it's just serendipity, really. I do think that our paths, that they are laid out ahead of us, and we have a choice in life, I like that scene in the Matrix, the red pill or the blue pill, we always have a choice.
Yeah.
So yeah, so I think that's kind of where my path started. And obviously, Silva Wellness then came out further along the line. But yeah, it's a long answer to your first question.
So what does Silva Wellness then
Yeah.
actually do in terms of just generally in terms of people accessing it? What are people wanting when they come to Silva Wellness?
Yeah. So I mean, the linchpin of the service is the ketamine lozenge service that we provide. And that was born out of, well, I've been working as a psychotherapist. I had my private practice on Harley Street, and I then discovered the world of psychedelics, my own personal journey, and which can be quite a big step, when you are in addiction recovery, especially being in 12-step treatment and 12-step rooms, and but again, we all have our own choices. But um I became really curious about psychedelic assisted therapy and was very inspired, to watch documentaries and read about it and learn about it. And then a friend in the field contacted me, a trauma expert, and she said, "Oh, I know you're into these psychedelics. There's a clinic in Knightsbridge that's doing this ketamine infusion, so intravenous ketamine service, and they're looking for a therapist to refer their clients onto." And, long story short, because it was a long period of time where I then had to seek out how to learn how to become a ketamine therapist, because of course you do have to get a certification to work with the medicine in that capacity, because you have to understand how it works, and for obvious reasons. And so I then went out to seek my certification because I knew, again, that was the area that I wanted to move into. And I was very lucky to have got my hands on experience for a couple of years with a clinic over in Knightsbridge in London. And then I wanted to really offer the services myself, but I also wanted to make them accessible and affordable for people, because in the UK, intravenous ketamine treatment is incredibly expensive, and the lozenges are less expensive and more accessible, obviously if you know how to go about doing it. And so really that's how Silva Wellness was born. I mean, me and my husband, who's the co-founder, and had sat down a number of years ago, and actually, interestingly, we wrote out a business plan of this well-being centre that we wanted to have, and it would be a big building, and there would be a cafe, and there'd be community, and it would be non-clinical, it'd be very, very holistic and a home from home environment. And that kind of, when I wrote the business plan for the lozenge service, I wanted to carve out packages and opportunities for people to access it cheaper, more accessible. And those two ideas really did end up coming together, and here we are. We were very lucky to have an angel investor who believes in this as a treatment service, as an option for people to access, having had her own experience and her life changing. And, I'm eternally grateful to her and her kindness, because it gave us an opportunity to get the service out there, to build this business and to reach people that wouldn't normally have access to these sorts of things. And then kind of just one step further on to that is that my mission is to get this into the NHS so that more people can access the treatment. And we'll probably move on to the research stuff that we're doing at Silva as well. But that's how it was born, really. It was born out of, again, my husband is also in long-term addiction recovery too. So we both get it. You know, we've both been on various sides of the coin. And so when we work with people and people come and see us, not necessarily, you know, in active addiction, you know, that is a contraindication. I would kind of stress that that's not the demographic of people that we do and can treat at Silva. But yeah, people will come to us looking for the ketamine service, and also for other things as well. You know, we do psychotherapy, we do specialize in addiction, so we do help people with on that side, you know, with therapy and coaching and group work, and we do sound healing and cacao ceremonies, and we do also have the community cafe as well. So we encourage people to spend time with each other, and we do free events as well at the centre, so that every month we hold it. We kind of nicknamed it Silva Cafe Presents, I believe it's called, and that's yeah, so people can come and do breath work or sound healing, or we'll give an educational talk. So yeah, so many different things that we do at Silva.
Yeah, an incredible range. Yeah, I was going to ask as well if you managed to get the cafe in. You know, you said it was
Yeah,
part of your original business plan, but
yeah,
no, that's fab to hear that you've also got the cafe already in place as well. Because I think
yeah.
those kind of informal kind of settings as well can be as powerful and kind of, you know, as instrumental in terms of
Mm,
what people are looking to achieve when they
mm,
access, whether it's services like yourselves or other similar ones as well. That
mm,
informality
mhm.
can really kind of help boost everything else that's going on as well, isn't it?
Right.
So when people come to you then for the ketamine lozenge, what kind of things are people presenting with? Certain mental health issues, for
Mm.
example? Is it past trauma?
Yeah. So yeah, I mean, it basically, in a couple of things that you just mentioned, they're generally the type of people that we would see. So usually treatment resistant. So treatment resistant depression, treatment resistant trauma, where people have tried a number of different SSRIs or antidepressants over the years and it hasn't worked, or they've tried many different therapies, they've tried, you know, so many different things to treat their trauma. So they're the most common two things that we see: people who have got severe depression, or just a depression that just they can't get rid of, they can't, you know, for want of a better way of putting it. And also the same with the trauma, you know, people who have complex trauma, so they may have, you know, it laid on top where they've experienced a number of different traumas over the years, or, you know, and then an acute trauma has triggered all of that stuff. It could be you know, what sits on top of that is relationship difficulties, and you know, they then isolate and they struggle with their confidence. And so usually you would have a formal diagnosis, and then of course, as you probably know, other things then just, you know, it's all dual diagnosis, or comorbidity. You know, there's more things involved usually, which you know, usually surfaces as we go through the treatment. But yeah, we've seen people with OCD as well, you know, a formal diagnosis of OCD. Uh, Usually someone, if they we've seen people who have had depression and a form of an eating disorder, or disordered eating at least, alongside of that as well. We haven't, not in Silva, but when I was working at the clinic, we did actually treat a couple of patients who had had ketamine addiction with the ketamine therapy, which is
Okay.
very interesting. And we saw really just incredible results from it. And I think it's worth mentioning, you know, ketamine, obviously street ketamine is usually bought in a powdered form, and it's used in a very different way to when someone comes into it. It was the intravenous that these patients were having. It's a very, very different process. You know, the set and setting is incredibly important. So the mindset of the person coming in, and then, because, you know, if somebody is using recreationally the ketamine, the mindset is very different. They're using it because they want to dissociate, they want to get away from they want to escape their feelings, or they want to use it addictively, and obviously in the clinic, they're doing it for a very different reason. They're coming in because they want to heal that. They want to work through those things. And of course, the setting is very different because you're in a safe container. You have a therapist and you have the nurse there, in that particular setting. So yeah, that, I mean, just touching on that previous experience that I had. But then, Silva, we haven't yet seen someone who has had addiction issues, but if we were to see someone, they would have to have had quite a long-term, recovery journey, sober for at least 5 years, if not more, because that recovery pathway has to be just cemented, in their behavioral system of, and we would see very quickly if somebody was coming in to have an experience, because that's not what we do. That's definitely not what we do, and we're quite savvy to spot that.
Yeah.
And also it's worth mentioning, because people have said before, oh, what if somebody just wants to, they've had an addictive pattern, or they just want to come and get off their face with the ketamine. It's like it's a robust structure, that somebody has to go to see a psychiatrist to have a full psychiatric assessment, and they look at their history. It's quite a process to go through for somebody if they just want to come and get their hands on some ketamine. I mean, with respect, you kind of think, well, you're going to be spending at least a couple of £1,000s to have the treatment. And also you're going to be the medical oversight is there throughout the whole process. So you've got a psychiatrist, that will always be not necessarily in the sessions, but overseeing the entire pathway. And then you've got, a professional psychotherapist that, knows what to look for. We haven't seen it, and it's very unlikely that somebody would go to those lengths, because it's a therapeutic pathway. There's no escaping that. So yeah, that's how we try to make sure that it's designed out so that we don't experience anyone that just kind of wants to try the ketamine lozenges.
Kudos to their determination if they do. The process that they got to go through. But it's really interesting, you say about the whole drug setting, and that it's going to be very different, isn't it, in terms of somebody going through that process like you just mentioned, compared to somebody who is going to use it recreationally for whatever purpose they do, as well. And obviously, even just the setting, like you said, compare somebody who's going to be in, on a night out having a bit of ketamine compared to somebody who's going to be within your settings. Just that is going to obviously have a great determinant kind of impact upon the experience somebody's going to have. But obviously, the setting that you provide is obviously there for a specific purpose as well. So Lucy, so what's it look like then? So talk me through. So when somebody is getting their ketamine lozenge support, what does it look like?
So what happens is, somebody would enter into the process. So they would inquire about the service, or we receive a referral, and we would already do a pre-assessment. So we would check most of the contraindications. So it's that pre kind of determination as to whether they are suitable for the process, because there's no point in someone coming in, going straight into a psychiatric assessment, and then discovering then that they've got contraindications, or they've got, that would be wasting their time, more than anything. So we do a full pre-assessment, which usually qualifies someone about 99% before they then go and see the psychiatrist. So we know the contraindications to look for. We'd ask about blood pressure, because one of the contraindications, if you have high blood pressure, that it's because when someone works with the ketamine, it can alleviate the blood pressure slightly as well. Not a huge amount, but we'd usually, stipulate that's a contraindication. And then if somebody has had psychotic symptoms. Bipolar is usually a contraindication, again, depending on, because I don't know if you've come across this, but there's certainly people that I know in my journey that have been told that they've got bipolar, and it's they're misdiagnosed, and that can happen a lot, personality disorders and various things like that. They can be misdiagnosed. So, those sorts of things are things that we can look at each specific case usually. But yeah, the pre-assessment happens, and then they would then be signposted to our partnering psychiatrist that works with us. They would then get a full psychiatric assessment. They would, depending on their sorry, just one step back, they'd also get their GP summary records. So in their GP summary records, it would obviously talk a lot about their history, the physical ailments, any physical ailments that they've suffered with. So the psychiatrist would have all that information as well. So then they'd do the full psychiatric assessment. If anything is flagged physically from them, they would then get their blood pressure checked. Sometimes they would ask for the person to go and do their blood so they can check various things. I mean, obviously I'm not a psychiatrist, so I don't know the ins and outs of that, but it depends on the person. But if it's straightforward, the psychiatric assessment will come up with, yes, that this person has TRD, for example, treatment resistant depression, or they've got a diagnosis of a CPTSD or PTSD, or they've suffered an acute trauma and that's triggered some childhood trauma, so that would kind of come up in the report. So we would then have an idea of, what the person is presenting with. Then the psychiatrist will prescribe the lozenges. So they will write a script for, because the treatment, the standard treatment is 6 weeks, but 8 weeks in total. So you have a prep week beforehand, then you have the 6 weeks worth of treatment, and then you have a review at the end. So it is 8 weeks in total, but you have 6 dosing sessions and 6 integration sessions. So then the lozenges, they get prescribed, and they usually have a dosing protocol of, we start on a low dose of around 100 milligrams, but of course that's not 100 milligrams of ketamine, because the body absorbs only about 10 to 15% of that, and that goes under the tongue, so it's called sublingual application. So when the lozenges are prescribed, the pharmacy then ship them to the patient, but the patient has them in a locked box, so they don't actually have access to any of the ketamine. And that is a protocol that we put in place, because I mean, we actually don't have to, and I say that in inverted commas, because it is the responsibility of the patient to hold their medicine. However, we know we're dealing with a vulnerable demographic of people who could have historically had, suicidal tendencies. So, my strong motivation to that is that, just mitigating risk, it's keeping the patient safe. So the locked box then arrives at their home, and during that time they're then scheduled in for their treatment. So we arrange their treatment, and then they would bring their lockbox into the centre. And what happens is, the therapist that they're working with, the therapist knows the code. The pharmacy and the therapist know the code, so they open the box. The client then knows they've been prescribed that amount, so they take out the lozenge. Lozenge goes into a little box, then the lockbox gets closed again, and it goes back in their bag, and then that again is in their care. So we don't, at the centre, we don't physically administer any of the medicine. We don't hold any of the medicine. We don't store it. It purely is in the care of the patient, but of course they don't have access to it themselves. So it's quite a clever system that we've come up with, and essentially we really are, I guess you'd call us a harm reduction service. So we're trained to facilitate the medicine journey, but we don't administer it. The client always has the medicine. They put the medicine in, they let it absorb, we don't handle it at all. But of course we oversee to make sure that they're safe and that they've got everything they need. And that's essentially how it works. They journey, usually a session We have 2 hours aside for a dosing session, and they're usually in the medicine for about 50 minutes to an hour, usually. And we'll do some processing beforehand. We double check that we'd go through a checklist before they take the medicine to say, if anything has changed, and do you have any other medications that you're taking, and then at the end we then do a closing out checklist as well. So we check their physically, are they feeling that they're back to corpus mentis? Do they have any suicidal tendencies or ideation? Is there anything that's coming up and that could just again checking mitigating risk? And they have a chaperone that takes them from the center as well, so they always have to have someone that comes to collect them, to go home after that as well. So and that's done one-to-one. We also see people two in couples, so duos or couples, and then also small groups as well. So we see small groups of 4 as well. So that's generally how it works.
Is the dosage just save them throughout the whole 8 weeks?
So they titrate up every week. So we go up about 50 milligrams a week. And then midpoint, they would have a review with the doctor that would check how is the dosage going? Is it working well? Some people, generally, people do titrate up every week because there depends on the person, because not everybody metabolizes it in the same way. But the reasoning for that is to, as the person builds a relationship with the medicine, they grow in confidence to journey deeper. But then also the body can build a certain level of tolerance as well. And also, but some people come to session 4, 5, and 6 and they're like, actually, I don't want to take any more. I feel like I'm getting enough out of, because it's not, there's different schools of thought around ketamine work. Is that we work with psycholytic doses, so that is it's not psychedelic. So psychedelic is it's usually when you have a higher dose, and you will achieve that full kind of ego dissolution or out of body experience, because ketamine is a dissociative as well. So however, saying that, if people do decide to go up every single week and then reach the final session, and sometimes, so that is about 400 milligram, some people do have a full psychedelic experience on that dose because it's a relevant enough dose for people to achieve that. And there are schools of thought that think that full dissociation, or what we'd call a K-hole, is needed to achieve the most desired outcome. I've seen different, because these are almost like therapeutic doses, so that you can work. Some people still speak during the sessions, which is really beneficial. We encourage people not really to do that, because it's quite, we have this kind of internal knowledge really that the medicine kind of works in conjunction with. But of course, most of the processing then happens 24 to 48 hours after, when we do the integration therapy. So the brain is still malleable at that time. And yeah, people generally report, if you're traumatized or if you've had depression or high anxiety, they usually say, it's the first time I've been able to observe my trauma or observe those things, as opposed to being caught in it. Because when we, people that are in therapy, talking therapy, they'll be so triggered by a memory or by an experience that they'll go into fight and flight, and they can't necessarily process what happened. But with the lozenges, they may be presented with that memory, but because the effect of the lozenges, that ketamine is also an anesthetic, so it is very calming for people. They can observe it for the first time in their lives. So when they come into therapy, they feel very grateful, because they're like, oh, I kind of realized, like, it's not me, it's not happening now. And that's the real distinction, when it comes to trauma specifically, is being able to see it as something that happened in the past and it's not happening anymore. So that's the really special things that I've seen, when I've worked with people in that. with the lozenges.
Yeah, it's fascinating stuff. I was gonna ask you in terms of, yeah, what surprised you the most really around the whole process, but it sounds probably is that sounds like one of the main things ultimately in
Mm,
terms of around the assisted therapy. Going back to the whole recreational kind of use of it then, do
mm,
you find yourself trying to deal with misconceptions or people having a misunderstanding around ketamine, primarily due to, the significant media attention around obviously the recreational use? I think probably over the last 12, 18 months, if not a little bit longer, we're constantly hearing within even mainstream media about, people who've been using ketamine for a long time and, and have experienced significant adverse effects.
mm,
One of our lost our one of our last podcasts was an individual who, at the age of 24, had his bladder removed due to long-term
mm,
ketamine use. And
mm,
obviously, recently, then the Advisory Council on Misuse of Drugs, the ACMD, have advised
mm,
basically to keep ketamine a class B, but it'd be interesting to
mm,
see whether the government stick to that or whether
mm,
they
mm.
they, they do actually put it up to a class A. Do you do you feel yourself ever dealing with trying to, yeah, deal with misconceptions around ketamine based on the recreational use of it and ultimately trying to get people to understand that actually this is a completely different scenario?
Yeah. I'll tell you one thing for nothing, Rob. This working as a ketamine therapist has certainly made me grow a thicker skin and become a lot more resilient to criticism and misconceptions, and interestingly, from people in the field as well, from mental health professionals. And this is a thing, right? Again, it comes to choice. We all have a choice. We can believe in psychedelic therapy, we can believe in ketamine therapy, or we don't. And that's all okay. And I'm like, everybody needs to live their life the way that they feel is best for them. But I think the damage can be is when especially when we're talking about, people in the field, mental health professionals, when they're not open-minded, and they can become very, and actually experience indirectly bullying-like behavior around the ketamine treatment as a treatment pathway, which I find incredibly sad. But I must address what you said, around the addiction potential of street ketamine and the impact. And I'm so sorry to hear that about, the previous guest that you had on it. What an awful experience to go through. And my heart really goes out to the people that are using this drug in that way, and that may well be impacted in that way. Because look, I speak from personal experience. I've been an addict, I've been addicted to drugs and alcohol, and I know how difficult it is to see the wood through the trees, and to think that life can be any different. So I'm absolutely not coming from a place of somebody that's just sat in an ivory tower and got a degree and think that I know everything. Like, I come from personal experience. So I always really want to weave that into my narrative, when I'm talking about this treatment. And, you're right that there is a lot of misconception. And, the only way we're going to change that, or make, or at least have some kind of impact, is to continue to talk about, do these kind of podcasts, and talk about, well, ketamine assisted therapy is a robust treatment therapeutic pathway. It's not just this, you just fall in. Certainly not our service, by the way. We just don't allow it to be something that, oh, I just want to try it out. That's just certainly not how it works. But and I'm on the I did read about that. I've been following the reclassification journey, and I did read about the what you just said, that recent update on that. I'm genuinely, either way, I I I think if it is reclassified, um I think that's not such a bad thing. Um but again, and that, because people said, oh, if it is reclassified as a, because is it a B at the moment? So they're talking about making it an A. Is that
Yeah, yeah.
it?
So it
Yeah.
changed from a class C, well, probably maybe 20 years ago, and now they're like in class B. But I think the interesting thing, maybe from a research perspective, is how it may change the implications for people to do more research on ketamine as well.
Mm-hmm.
Do you know? So it's not obviously just the impact upon the individuals that use it and sell it and stuff like, but I think there'll be implications in terms of people getting licenses to do research on ketamine
Mm-hmm.
if it changes as well. But
Yeah, that's interesting. I mean, let's see what they do, and it would be sad if it did put more red tape in the way, and more issues with getting research signed off. But at the same time, you kind of think there's been quite a lot of research already done, on the intravenous and intramuscular, not so much on the lozenges. There's actually been a big I believe it's like a long-term study that's been happening in Canada with the lozenges in a group setting, and there's a documentary that's being screened in London that Chris and Neil are OEV partners, are big players in getting that seen, and that is a documentary about the ketamine lozenges being used in a group setting for frontline services in Canada, and it follows their journey of the treatment and how it's been received, and how their lives then change as a result of it. So there's stuff out there, and there's anecdotal stuff, and as in, like, from the ketamine services, and hopefully, I kind of get this, kind of segues on to our research that we're doing, which is um it's the it's backed by Innovate UK, and we're working with Hertfordshire University, and it's a short term. It's a very short one. It's not involving any participants, but it's for, in fact, it's for addiction healthcare goals. So the idea is that they're looking for new innovative treatment pathways for the community addiction treatment services. So essentially, like, it will be the NHS that because they're looking at the current addiction pathways that they have, and that they've seen how much it's addiction is, substance use misuse is still costing the economy. And so they need new innovative treatments, and the lozenge pathway is something that we are testing in terms of, like, how would we deliver it as a treatment pathway, what practitioners would need to be involved, what kind of knowledge would they need to have, and also, can we scale it across the NHS? Because of course that's a big question when you're looking at treating a massive demographic of people, and because it is the group model. So it's a trauma-informed group model that we're looking at. So, when we have the white paper from that, which will be about springtime, we can look at the next step, which could possibly be piloting it out across community services in the UK, in the NHS. So, there's scope for the masses inverted commas to get this treatment. And if I'm honest with you, Rob, that is one of my biggest missions, is because, from a personal motivation, like, I come from nothing. I come from a very traumatic and neglectful background, and of course that did lead to addiction. So when I see that there are people that are in that position that probably don't have the means by which to access these treatments, that for me is my main motivation, is to make this available for people so they can get well and have a better quality of life. But I'm kind of going back to your earlier question about the misconception. A lot of that comes with educating people, and also being really compassionate to people that get really triggered by this, and like, oh my God, it's dangerous, why are you doing that? And but just having a bit of compassion for people that don't really understand it. We've all been in different parts of our lives where we've, excuse me, probably had a misconception around many things, and the only way we've learned any different is to be educated around it. So yeah, that's the main thing I want to try and do this year, is to get myself out there and talk more about the ketamine clinical medicine, as opposed to the street stuff, which of course is incredibly damaging and can cause a lot of problems.
Well, it sounds like, you're doing brilliant work, and it's fascinating just kind of talking to you really around it. Even in the 45 minutes, I've learned a lot. We had a ketamine conference in Swansea last year, and looking at some of the research from the impact it's had, especially around treatment resistant kind of depression, was hugely significant, compared to more traditional kind of treatment options as well. So, if you're able to achieve your goal, or at least get a significant part way there, I think it's going to be a bit of a game changer for quite a lot of people. So good luck in terms of with what you're doing over the next few months, especially in terms of the research with Innovative UK, from that as well.
Thank you.
Lucy, if people want to follow you, where would they do that?
We have Instagram, so we're at Silva Wellness. We've got LinkedIn as well, for any professionals out there that want to follow us on LinkedIn. I think that are our main platforms. But they can also meet me as well. I have my own Instagram. It's at It's Lucy da Silva, so people can follow me on there as well, because I try and do a lot of like thought leadership around the treatment and various other sort of holistic stuff as well. So or they can visit our website, www.silvawellness.com.
Brilliant. Lucy, thank you so much again for your time, and it's just been fascinating hearing about your work and everything that comes along with it. So best of luck moving forward, and I myself will definitely keep a keen eye on the progress that's being made within the kind of whole ketamine assisted kind of therapy and psychedelic assisted therapy as a whole. So Lucy,
Amazing.
Thank you very much.
Thanks, Rob. Thank you.
And to everyone else, we will see you soon. Bye-bye. If you have been affected by any of the issues discussed in today's podcast, please reach out. Barod have a free and confidential live web chat service that is available 7 days a week on our website at barod.cymru, where you can chat to a trained support worker. Alternatively, you can contact Wales's National Drug and Alcohol Helpline, Dan 24/7, either by calling 0808 808 2234 or text Dan to 81066.